Hello and welcome to this video on diabetes. Diabetes is a growing health concern affecting millions of people worldwide. It is a chronic condition that occurs when the body cannot produce or properly use insulin, which is a hormone that regulates blood sugar levels. In this video, we'll be discussing everything you need to know about diabetes, including its types, its symptoms, causes, and treatments. We'll also go over some practical tips for managing diabetes and living a healthy lifestyle. So let's get started. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes. Type 1 diabetes is an autoimmune disorder where the body's immune system attacks and destroys the cells in the pancreas that produce insulin. It usually occurs in children and young adults, and they must take insulin injections or use an insulin pump to manage their blood sugar levels. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes and is caused by insulin resistance and a decreased ability to produce insulin. This type of diabetes is often linked to lifestyle factors such as poor diet, lack of physical activity, and obesity. Gestational diabetes. Gestational diabetes is a temporary form of diabetes that occurs during pregnancy. Women who have gestational diabetes are at risk of developing type 2 diabetes later in life. The symptoms of diabetes can be subtle and may not be noticeable for a long time. Some common symptoms include increased thirst and frequent urination, hunger even after eating a meal, fatigue and weakness, blurred vision, slow healing of cuts and bruises, numbness or tingling in feet and hands. If you experience any of these symptoms, it's important to see a doctor for diabetes screening. Early detection and early treatment of diabetes can help prevent or delay the onset of complications. The exact cause of diabetes is still unknown, but there are several factors that can increase your risk of developing this condition, which include: First, genetic. If you have a family history of diabetes, you are at higher risk of developing this condition. Lifestyle factors. Poor diet, lack of physical activity, and obesity can increase your risk of developing type 2 diabetes. As you age, your risk of developing type 2 diabetes increases. Certain ethnic groups such as African Americans, Hispanics, and Native Americans are at higher risk of developing diabetes. Now, there is no cure for diabetes, but it can be managed with the right treatment plan. The goal of treatment is to keep blood sugar levels within a target range to prevent or delay the onset of complications and to improve overall health. Treatment of diabetes, it includes: first, medications. There are several different types of medications that can be used to manage diabetes, including insulin, oral medications, and glucagon-like peptide receptor agonists. Second, lifestyle changes. Making changes to your diet and increasing physical activity can help manage diabetes. Third, monitoring blood sugar levels. Regular monitoring of blood sugar levels is an important part of managing diabetes. Living with diabetes can be challenging, but with the right treatment plan and support, you can live a healthy and fulfilling life. There are some practical tips for managing diabetes. Maintaining a healthy diet. Eating a balanced diet that is low in sugar and saturated fat can help manage diabetes. This includes eating plenty of fruits, vegetables, whole grain, and lean protein. Staying active. Regular physical activity can help control blood sugar levels, improve insulin sensitivity, and reduce the risk of complications. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Monitoring blood sugar levels. Now, regularly monitoring of your blood sugar levels is an important part of managing diabetes. This can be done with the blood glucose meter. Managing stress. Stress can affect blood sugar levels, so it's important to find ways to manage stress, such as meditation, yoga, or deep breathing exercises. Getting enough sleep. Sleep is important for overall health and can also help regulate blood sugar levels. Aim for at least 7 to 8 hours of quality sleep each night. Staying on the top of appointments. Regular checkups with your doctor, endocrinologist, and eye doctor are important for monitoring your health and prevent complications. Knowing the signs of low blood sugar, it's important to know the signs of low blood sugar such as shakiness, dizziness, and confusion so you can treat it quickly. Taking your medications as prescribed. Taking your medications as prescribed by your doctor is an important part of managing diabetes. In conclusion, diabetes is a chronic condition that can be managed with the right treatment plan and support. By making healthy lifestyle choices, monitoring blood sugar levels, and staying on the top of appointments, you can live a healthy and fulfilling life with diabetes. Thanks for watching. If you have any questions or comments, please leave them below. Don't forget to like and subscribe for more informative videos like this one.